and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am streaming live from the Team Needham Abode podcast studio, and I am super excited to introduce Dr. Richard Eggleston today. I actually got the pleasure of talking to him a few weeks ago. I was introduced to him by a good friend of mine, Dr. Renata Moon, who has been in the news lately a lot also, and I was actually honored and privileged to actually meet him in person Saturday, and he did speak at our Medical Freedom event and did a wonderful job of telling his story. He has practiced medicine for over 50 years. His license is in a retired state, and a few years ago during COVID, he wrote some op-ed pieces in the Lewiston newspaper, and the Medical Board of Washington got him in some trouble, and now he's fighting for his license. So, Dr. Eggleston, welcome to our show.
Well, thank you for having me, Shawn. I appreciate this very much.
Yeah, I love hearing your story. I'd love to hear it again. So tell us about your story of when you started practicing medicine and then how you're here today.
Okay, well, I graduated from the University of Kansas Medical School in 1967. I interned with the Army at Letterman General Hospital in San Francisco from 67 to 68. And then I went into flight surgery training, and as a flight surgeon, I was in Alabama, and then we were stationed in Europe, in Verona, Italy, and then up in Heidelberg, Germany. When I was in Verona, I was the flight surgeon for the station there. And it was during that time, as I mentioned to you, that I got my first really eye-opener of how supposedly competent people with knowledge and can make stupid mistakes and even deadly mistakes. And this first one was when I was supposed to be on a flight to go from Verona to Milan, Italy, to pick up the new two-star commanding general for what's called the Southern European Task Force. The executive officer and operations officer were on the flight, but I didn't get on it because I wasn't notified of it. So, which is fortunate. So they fly and pick up the general, and instead of taking off safely, they crash and kill the general and the executive officer. And it was because they were pointed at the short end of the runway. With all the experience that both of these pilots had during NAM, of probably the total of around 10 or 12,000 flying hours, they didn't even check the compass on their dash of the airplane to tell what direction they were going. So they ended up killing two people, and the executive officer got hepatitis C out of this and other things. So that was my really first eye-opener that people supposedly knowledgeable didn't do things right. And then I went to when I was in practice, which started in 1974 in Spokane as an ophthalmologist. I had took my ophthalmology residency back at the University of Kansas. So in about 1997 or so, I went to a meeting in Las Vegas that was a alternative medicine. It was by the organization called American Academy of Anti-Aging Medicine. And all the people that were presenting were MDs and PhDs from major universities. And I like sometimes you go to meetings, you plan to go for a couple hours and then dodge out. So actually, at that meeting, I spent 4 straight days from 7 in the morning till 7 at night listening to information that I had never read, never heard about in medicine. And I said, holy smoky, this has got to change my life, which it did. So Betty and I both got started on bioidentical hormones and many other things. And that's when I learned at that first meeting how important vitamin D was. And it's now just in the past few years, docs are beginning to understand that this is a really important thing. So we've been on high dose of that for 25 years or so, which has been a big help for us. So during the time I was in Spokane, I was the chief of staff at the hospital in the Valley, and also on the Washington Academy of Ophthalmology as secretary treasurer for 2 or 3 terms. And also later on, after I moved to Clarkston, Washington, I was also still on the trustees of the Washington Academy of Ophthalmology, and also on the Washington Medical Quality Assurance Commission, which is what it was called then. Now it's called the Medical Commission. And I had two terms, 3-year terms. And the commission at that time was not political. They were doing what they're supposed to do, evaluate complaints by patients who I think have a right to complain and get some kind of result. And at the time, they were, like I said, not political, and they were doing the job. And so I retired about somewhere around 2010, 2012. These years kind of flow by after you retired. And I was actually, just kind of not doing very much. And then in the fall of 2020, the local paper, the Lewiston Tribune, had put out a request for conservative writers. And I have always read, I've always kept up on medical and political things. And it was very interesting to me to do that. But on a Friday night before this announcement came out, I was sitting at my chair reading, and I had the thought, I said, God, I love to read and know this stuff, but I think you want me to do something with it. And so 2 days later was the announcement in the paper that they were looking for conservative writers. And I had written many letters to the editor and actually paid for a piece about the 2016 election. And so they took me on and to write. And since January of 21, I have written about 38 articles, including the one published on October the 1st yesterday. So the second article, I took on the whole COVID thing because I've been reading and understanding how wrong this was. And a bunch of the local docs, 8 of them, as a matter of fact, wrote an op-ed to the paper saying how wrong I was. 5 of these guys were retired. One of them was actually my physician, and he kicked me out of his practice for what I had written because he said I was not understanding the suffering the patients were doing and going through and how difficult this was, and I was giving misinformation out. As it's turned out, everything I've written about has been vindicated and over the past 2 or 3 years, and especially recently.
Which was what? What did you specifically write about?
Well, I talked about that I was concerned about this COVID virus. Was it really a wild one, or was this a manufactured one? And I started writing about ivermectin and hydroxychloroquine and all the other things that could be done to keep you healthy and keep you get you out of the problem of having the infection. And they, like I said, didn't like that. And then a person from a surrounding town who I'd never met, he was not my patient, nothing. He wrote a letter to the commission saying I was saying bad things and going to kill people and they were going to die and all that. As it turned out, I find out he's written 3 letters to him, but that was the first one. And so they started an investigation, which, as I said, the commission should do, just for make sure patients are getting proper care. But this was a political event that they went after me for. And so they actually filed charges against me in August of 2022, and that started the process. And I have to say that I actually expected and actually welcomed having this commission because there was no information getting out that I thought people were entitled to for their health and just for the freedom of information that we're supposed to have. So it's got to the point that about in August, we had an appeals court in Spokane grant a temporary restraining order against the commission so that they couldn't go after me any further. And then last week, the second or the appeal court in Spokane restated that again, and the commission has about another 3 weeks or so to respond to it, but that still enjoins them from doing anything against me. And they need to stress that my interaction with this patient there was no interaction with this person who filed the complaint, and so this is strictly a First Amendment issue. And my attorney, who's with, one of my attorneys, my local one, and Todd Richardson, and Rick Jaffe, who's with Children's Health Defense. Rick said, I've been looking for a pure case like this my entire career, that have a First Amendment without any patient involvement or treatment or anything. So he's very excited to be working on this. And there is, I don't know if he thinks or hopeful for it or not, but he's willing to take this to the Supreme Court of the United States if necessary, because this is, again, just a pure free speech issue. So we won't know whether the entire appeals court is going to grant this permanent injunction, but we're hopeful that will happen, but it could be a few months yet before that's decided. But regardless, we're still going to fight for the First Amendment right to speak, and for a doctor to be able to tell these patients what he thinks is the best for him, instead of having to do a cookbook, recipe, treatment, or not even be able to talk to the patient about what is beneficial for him and what he should know and has the right to know. As one of the big things about the Nuremberg trial was that patients that came out of it was that patients have many points that have to be fulfilled before experiments can be done on them. And none of this was done in the COVID trials so far. And as we know, many of these vaccines were approved with no real long-term study, and not the typical way that any vaccines have been approved before. So that's where we're at with the Medical Commission now. We're waiting for the time to expire. I'm thinking that there's a reasonable chance that they're not going to want to take this case any further, because they don't want to have the precedent that they have been defeated on a permanent basis. And they hopefully, I think they're thinking that this First Amendment issue will go away, because they don't want to have that come up either. So, as we all know, the Federation of State Medical Boards in 21 put out a statement saying you should go after docs who don't state everything that we want stated about COVID and ivermectin and everything. So, this is where we're at. And Rick, by the way, said that my case is the only one in the United States that's a pure First Amendment right case. And actually, these injunctions against the commission are the first that he's aware of in the United States also being successful. So we're happy to fight this battle. It's something that, as I mentioned the other day, as Ronald Reagan said, freedom's not free. It's got to be fought for by each generation to be passed to the next, and for them to pass it on too. And so I write these articles, not only because I like to, but for my children, grandchildren, and now great-grandchildren, for patients, so that they get the right to hear information they should, and that doctors can give the information that they should and are supposed to give the patients. And so there's, in our history, to maintain freedom, people have been shot at and killed. The only thing we're required right now is to use our voice and words and have some grit to fight this thing through.
Yeah, I love it. And thank you, Dr. Eggleston, for standing up. We need more physicians like you. Now, I got to ask, you said the commission filed charges against you. What did they actually charge you with?
Well, there was about 5 or 6, 7 things. I actually don't remember them all, but one of them that I was given disinformation, that I was saying that COVID or that ivermectin was good, and that the vaccines had problems, and I was exhibiting moral turpitude by stating these things, but everything that I've written about has been vindicated, like I just mentioned earlier.
Yeah, right. I mean, the truth eventually comes out, and we just got to stop these medical boards from doing things like this. And I've heard that Washington is one of the worst ones. I know at the Medical Freedom Conference, which you were at Saturday, there was a group of Washington physicians that's also suing the Medical Commission. And between 4 physicians, there were 22 complaints filed against their license. I have to ask you, of all the 50 years you practice in medicine, how many complaints did you get against your license?
I practiced in Idaho too, because it's a border state. And about 25 years ago, there was an Idaho complaint from a patient that had angle closure type glaucoma, and so he filed this with the board there, and we had a meeting, and there's nothing that came out of it.
Yeah. So in 50 years of practicing medicine, you had one complaint, and there was not a lot came out of it, and now you have to fight for your life. Yeah. Now you're having to fight for your license for writing a letter to the to in the paper.
Well, I'm not really, in a true sense, fighting for my license. I'm an active retired status, which I kept active so that in case there was some kind of a national or state emergency that medical people were needed, I could jump right in without having to go through the reinstatement process. But it's actually turned out to be beneficial because of this case that I did keep it, because if I had been retired, the commission would not have gone against me at all, because they would have had no basis to. But they thought that since I was still had an active status, that this would be grounds for them to go against me. And they wanted me to agree to that I was that I had made some infractions and they would drop the matter. Well, I said, that's not going to happen, because this is a First Amendment issue. This isn't whether I practice medicine right or wrong. This is whether I have the right to speak, especially not about a particular patient and no patient treatment involved. And so that's one of the reasons Rick is so excited about this. And the whole, I think CHD, the Children's Health Defense, is interested, and Robert Kennedy himself is aware of this case, because he mentioned it on a national interview that there was this case in Washington State, this Dr. Eggleston, who's fighting the commission. So it worked out good that I had kept my license active, or otherwise none of this would have been able to get out.
Well, it just brings up another point, is that, like you said, if you didn't have a license, they couldn't do anything. So they couldn't control you. But now, since you have a license, they try to censor you. And it just is proof, in my opinion, that medical boards are using licenses as they're weaponizing licensing. It's like, well, you don't do what we say, we're going to take your license, which essentially takes your livelihood. And Dr. Scott Jensen out of Minnesota, we've interviewed him a couple times. I've met him a couple times. He mentioned that early on in the government-created pandemic that, states were weaponizing licenses. And because he had no complaints after practicing medicine for 30 years, he had no complaints against his license. Then all of a sudden, when the COVID pandemic happens, he's got 5 complaints he's got to fight for his license, and they were like yours, they were all political. None of them were from patients. They were actually from other doctors that didn't like what he was saying. And, then he had to fight for it. And that's just, and the thing is what I appreciate about what you're doing is that you're not, just like you said, you're not practicing medicine really anymore. I mean, and this is not your livelihood, right? So
Correct.
That's not what you're fighting for. You're fighting for people like me that has a pharmacy license. You're fighting for other doctors that have licenses, and you're fighting for their patients. Because if we don't stop these boards, whether they're medical boards, nursing boards, or pharmacy boards, which all 3 of those professions have been hit during the pandemic for spreading misinformation, we will just be wars of the state, and the state will just tell us how to take care of patients, and that is not what's good for patients.
Yeah, absolutely right. Yeah, the Federation Board, they, as I mentioned earlier, put out this statement that this is what they want the boards to do. And there's besides the states, there's a total of 70 entities that they have control over on the board certification. So, or state boards. And so like many of the hospitals, they actually receive payments from various government agencies. I believe it's the CDC and NIH, as far as I know, to promote only the COVID vaccine and the line that's being put out about the infection. And so I know there's a physician, and he's been interviewed many times, Dr. Thorpe, who lost his standing at St. Louis Hospital and was told specifically if he wasn't shut up and he didn't start towing the line, they would suspend him, and it was because the hospital would lose funds if they didn't enforce that kind of thing. And so that's one of the reasons that remdesivir and ventilators were used, because hospitals were receiving money the whole way through this problem when a patient would come in. But they also had to toe the line that this was the way that people should be treated. And if they didn't, they would lose funding. And I think there's probability, I'm not certain, but I'm pretty sure that even the Federation of State Medical Boards has funding that they lose if they don't do it. I think the chairman of the one in New England, I think it's Vermont or New Hampshire, is one of the members on that board who's also taken away or trying to take away the license of a physician there, Merrill Nass. So they are doing a political hit like is happening throughout the country. And the government, is, as we all know, has been able to work with the social media groups to prevent information from getting out and taking it off and not allowing it to be on. There was a statement from the Mayo Clinic that they were going to allow ivermectin use in certain things, or recommended it could be used. Well, that blog was taken off after a few days, because why would they take it off? They don't want that information out that it's being accepted. And as one of the speakers at the conference talked about how successful ivermectin is, everybody knows that. It's been used over 4 billion times with minimal, if any, real side effects from it. And it costs 4 or 5 cents, or maybe even a penny to make, versus this other new prescription or drug for that's similar to ivermectin. It costs $400 or $500. So you can see where all the money is.
Yeah, as usual, just follow the money. Now, speaking of that, do you remember, or do you know, the National Federation of Medical Boards?
State boards.
Okay. Yeah. Do you?
Or maybe it is medical boards, but National Federation.
I'm not sure. I think we get the gist. Pete Serrano was talking about that, the attorney that's fighting for some other doctors, and, at the Medical Freedom Conference, he was talking about that there's the funding that they get is from some interesting sources. Do you remember where he said those funding, where they were getting funded from?
I did not hear his speech, but I assume this and know that there's been many other fundings from, like, the Gates Foundation, Soros groups, and things like that. And again, it's just a way to control population and to make us toe the line. This is more of a totalitarian type state, because instead of a dictator, in a way, because totalitarianism, really, you're afraid to say anything or to do anything, because you'll be reported or somebody will hear about it, and versus you being shot and everything if you're in a dictator type thing. But here in a totalitarian, I think there is a difference, that you just are afraid to say anything.
Well, and when you look at history, eventually totalitarian governments end up being dictatorships,
right?
And that's when people start getting murdered. And I know that people think you're crazy when you say things like that, but just look at history. And we were shared over the weekend. I found out an interesting statistic. You talked about Nuremberg, and one of the things about Nuremberg was there were a lot of medical experiments going on with patients, and informed consent was not being done. And that's one of the things that we talk about when we believe in medical freedom, is informed consent. It's a decision that the patient has to make, but you need to give them, good informed consent and good information. At the Nuremberg trials, there were 27 people executed, and 7 of them were physicians.
Right. And
I did not know that. And Dr. Kelly Victory, I think, was the one that mentioned that over the weekend, and I was just blown away. Which, it's just hard to believe that physicians would go along with the narrative, and totalitarian governments create so much fear in people that's what happens. But remember, in Nuremberg, just following orders didn't work.
All right. Well, that's what I'm afraid a lot of docs and hospitals are going to find out with a lot of suits that are coming against them. And I'm aware of one going against a hospital in Phoenix because they would not allow, even following a court order, the patient to receive ivermectin, and the family is suing that hospital because of that.
Good.
It's true. And so, yeah, this is going to take a lot of people to become aware. And I think there is a great awakening of what's going on. I hear so many patients or people that talk to me and former patients saying, I'm so glad you write this stuff. As a matter of fact, let me divert a minute. When I first started writing these articles, I got emails from doctors in the U.S., Canada, Britain, Brazil, New Zealand, Australia, saying they wish that they could write these kind of things and say these kind of things, and for me to keep on writing. And from those same countries, and at least half the states, I got emails from people saying we just can't find any information. Thanks for putting this out. And so I put out all the sources that I got my information from so that they could look for themselves and find it. But, going back to the docs doing and being not strong in a way, I'm not against or don't feel animosity towards all of the docs, because some of them have a problem with their livelihood stuff. But the bigger issue, I think, is that if they are debarred or de-licensed and can't see patients, what happens to all those patients? All of a sudden, they're going to be shifted onto the medical system, which is strained already. So I think as long as they, don't actively promote all this stuff and follow the line, I don't have, any bad feelings towards them. It's the ones that continually say, you got to do this, follow the science when the science is hidden from you, when they won't reveal all the information from these trials. The Pfizer wanted the CDC to bury the evidence for 75 years. Why would that be necessary to not?
Right.
There's obviously
Right.
something wrong. And all these kids, these babies getting these vaccines, these COVID vaccine shots. I mean, there's no need, as we heard at the meeting, that 0.003% of children who contract this get any kind of serial illness. And
if we have all the data, there's even some thought, like Dr. Renata Moon says, we don't really know if any children died of primary COVID. Right. We really don't know. It's hard to trust the data.
Right. Well, you can't trust data at all, as a matter of fact.
No.
And it was she or Dr. Victory that talked about how the medical journals are so corrupted now, and the previous editor of the British Journal and the Lancet, and actually even the JMA, they have all commented about how poor the studies are, and most of them have a good portion of fraudulent in them, and they have to retract so many articles. More than 10 or 20 or 30% of them have to be retracted for false information. And so if the medical journals are allowing this stuff to be put out because they're getting money from the pharmaceuticals who support them all, we can't really believe anything that's being said. You have to find a good doc who is honest, who has the moral integrity to tell you the truth and not just do things for money or so. So, medicine is in a big quandary, and part of it is because, as I wrote in one of my articles, the corporatization of medicine. Yeah. And if you belong to a group, and it's like one of the speakers I was talking about, Dr. Edgerly, and you kind of have to follow what they say, or you can be kicked out of the system. Well, in some ways, that's probably a better idea, as she has shown, that you can do very well being out of the system without any controls put on you, and the patients are happier and everything. So.
Absolutely. I agree with you 100%. Well, Dr. Eggleston, you truly are a hero. You may not realize this, but you truly are a hero. And doctors like you, sometimes you don't realize it. And you saw the doctors that were in the room Saturday at our Medical Freedom Northwest conference, fighting for just what you're fighting for. This has implications for decades.
Right.
I mean, it really does. So, you are going to create a legacy because not very many physicians, if any I've ever heard of, actually have been able to fight for their constitutional right of freedom of speech. And you're doing that. And I so appreciate it.
Well, thank you for the comments. And, like I said, I don't think of myself as a hero. I feel as somebody that's doing their job. And as I said earlier on, trying to protect my offspring, my great-grandchildren that are around now, because if they are unable to get proper care or phony care, then their life is in danger. So there's many reasons that I outlined earlier that I've decided to take this challenge on. And actually, it's not been a stressful challenge or anything for me, because I know we're doing right and what should be done, and so I have peace of mind.
I love it. I love it. Dr. Eggleston, we're winding this podcast up, and I can't thank you enough for being on our show today. I really appreciate it. And thank you fighting for freedom of speech for your patients. And you helped us realize our goal. And our goal of this podcast is to educate and empower individuals to take charge of their own health. And, without a doctor being able to say information that they believe is fact, then we've got a big problem and patients can't take charge of their health. So Thank you so much for being on today.
Do I have another minute, or you have to cut it? I have to give a kudos to John Stockton, who spoke, and it's because of him, or actually me contacting him and him reading my initial stuff and making contacts with that, like Renata, that then contacted me with you, and then him contacting me with CHD to get the attorney. So as he writes in his book, his autobiography, it's a concentric circles that enlarge and overlap, and we influence each other and enlarge the circles that we need to have for support. So
that's exactly right. And thank you for doing that.
Well, thank you. I appreciate this very much and hope it's helpful.
Yeah, thank you so much. And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Thank you so much.